Well, welcome back. We have Dr. Carrie Winterstrom, and she was actually the first Firefly Friday we ever had almost 2 years ago now. So welcome back. And I heard you had a number of successful case studies. Would
Yes.
you like to talk about a couple of them?
Yes. I think before I've talked about the post-COVID lung, so today I'm not going to talk about that, but those are definitely some really cool things. I think that was on the first recording. So the first one is going to be a patient who presented, and he's in his 70s. He's presented with severe cognitive decline, very sudden, and wound up being evaluated for dementia. Okay. So when he came to me, and that would have been at least 6 months ago. Let me look here. It would have been, oh, almost, my goodness, almost a year ago in February. He first came in and used to live independently. He's somewhat developmentally disabled to some extent, but lived independently and was hospitalized. And after the hospitalization, he wound up being put into a long-term care and was lost his independence. And so his adult sibling advocated for him and brought him in. And I did multiple things for him, including supplements, and wound up doing some testosterone too. He's in his 70s, but also Firefly. And so he had first, we kind of did out of order. We did one Firefly to his brain, and then wound up doing 3 Fireflies to his gut. And it was within a few weeks, but the gut was in pretty close succession, pretty much one day to the next within a week. And with everything that we did, and he has had an improvement in his cognition. I was specifically told by his sibling that the Firefly, she could tell cognitively he had improved. And so it was a part of the whole of everything that we did. And he really only had the 4 treatments. And so I just saw him in office about a week or so ago with his sibling. And he had already had a very lengthy neurocognitive evaluation that was an all-day event. It was at least 4 hours, if not, 6 or more. And I have the report. And the gist of that is that he does not have dementia and that he just has a lower IQ. But he has made significant improvements over the course of the last, 10 months or so. And Firefly was part of that for him. So we're really happy to see him. And she's trying to get him out of long-term care to live independently again, which should be really, really neat.
Wow, what an improvement. That's awesome. That's
Yep.
really awesome. Yeah.
I have another gentleman who he's in approximately 80, and he had a stroke many years ago. And he did, let me look, where's his chart? I pull it out. Yeah, hold on here. So he's been my patient now for several years. Well, I should say he had a myocardial infarction many years ago. And I trying to recall now if he's had a stroke too. He's had cognitive decline, that's for sure. And he presented in May of 21. Yes, he did have a stroke. He had a CVA in April of 21. So he initially had hyperbaric. I've done supplements for him. He's had chelation and still is having some cognitive decline. And so he doesn't live here, and they travel all over the place. And they spend time down south, they spend time in Canada. And so they come to the clinic kind of as the seasons allow. And he had, I got it written down, he had 6 Fireflies for his head. And they noticed positive changes. His jokes were coming quicker. He loves to joke, since he was joking much more quickly than usual. And staff was noticing as their interaction with him that he had improvement, and he was noticing improvement as well. And then I would talk about a couple of people with parasites, because that's one of the big things they discuss, that the Firefly is very good for pain pathogens and parasites. So one patient, very interesting, a terrible, like a sunburn, kind of a rash on their upper chest, décolletage, arms, hands, fingers for years. And what turned out to be a big source of their problem was parasites. and they had lived overseas. They were in the military for a while. They also received many different types of vaccinations. In fact, it seems they were part of a pilot program, kind of experimental, and in terms of vaccines, and so not quite sure what all was received. So there were compounding kind of factors in this person's health history. But when it came to doing the full moon, which we used, a product line for that in conjunction with the Firefly, this person had just 2 Firefly treatments within one full moon session, and they passed parasite after parasite after parasite. Showed some pictures to my staff. Flukes, she passed a very long worm as well, and it was really cool to see that her rash just completely dissipated. I mean, what was covering her upper body. She works in a part of healthcare, and she was very cautious with wanting to work with patients because of how she might be perceived with having such a terrible skin affliction. And it completely all cleared up. I also did some ozone on her too, which was awesome. She really enjoyed that as well. But she just kept saying over and over again that to her, it was the parasites, how she was loaded with parasites, must have been loaded with parasites for a very long time. And getting them out was a huge part of her getting well. And she was just crying. She was crying happy tears on multiple different occasions with how she was progressing.
Wow. So, we talk about brain gut connection, but also obviously skin gut connection. And
Yes.
probably
Oh,
her body
yes.
was trying to expel that, the toxins that are the excrement of the parasites out. And that was what was responsible for that rash.
There's a dermatologist I refer a lot of patients to, and he's one of the most intelligent people I know. I highly respect him. He publishes every month in a journal, and he's on staff at some of the major teaching hospitals in town. He lectures internationally, and he'll tell patients that your skin, of course, is your largest organ, but he'll tell them that what goes on in the gut tends to come out through the skin. And that's such an important connection to make that a lot of people don't. They just compartmentalize everything. And it's important not to do that because, especially as an osteopath, I'm taught from day one of medical school that the mind, body, and spirit were all connected. You shouldn't compartmentalize things. What happens in one part of the body can definitely affect something somewhere else. I see it over and over and over again. And so parasites, people don't understand when your gut flora is disturbed from fungus, parasite, viruses, bacteria, whatever it is, it can wreak havoc on lots of things, including mental health, your skin, of course, bowel. People can have aches and pains from it. They can have insomnia. We know that parasites tend to replicate over the full moon. And so some people don't realize that maybe when they're not sleeping very well over the full moon, especially, it could be from parasites. There could be other reasons too, the lunar cycle, lots of things happen to the lunar cycle, but it's very interesting. And a lot of people have parasites. You've said, 4 out of 5 people have parasites, have a parasite burden. And so I think it's important to question people. I give them a parasite questionnaire to fill out. And even if they score low, I'm typically treating for parasites because of the statistic probability that a person has parasites. And I like to do a questionnaire for them because I tell them this helps you understand maybe some risky behaviors that you're participating in that you don't realize are a problem, such as sleeping with your animal, letting your animal kiss your face, eating raw sushi. I'm personally not going to stop swimming in fresh bodies of water. I enjoy that very much, but I also understand and I have an obligation to myself to reduce my parasite burden, after I've done that. I've stopped eating raw sushi though. I stopped doing that several years ago. I've done multiple parasite cleanses, done the Firefly. I'm not going to make this about me, but let's just say that I practice what I preach. I think it's very important. My staff does too. I have staff who will openly share with patients, even pictures, if they don't mind. Um, So the last one I have is a really complex case, and Firefly has been part of what we did for them. And I don't know that I'm going to have a total number on there because I'd have to kind of dig through their chart some. But they're a chronic Lyme patient, and they came to me a couple of years ago. It was, well, I guess April of 22. So not about a year and a half ago. And chronic Lyme patients can really have a terrible parasite burden, mold issues, mental health problems, lots and lots of things. And so part of what we did for them was full moon over and over again. And I think we were at like 5-6 months doing the cleansing. And they sent us well over 60 images of worms that they gloved, would pull out of their pristine kept toilet, I will say, and took pictures. And there were all different kinds. When they're dead, it's not so easy to identify them, which is really frustrating because I actually they asked me to send off one to the lab. It's very clearly, looked like it was a rope worm, one of them. And they have just very distinct features, and they're not documented very much in the literature. And so we sent it off for pathology and came back with nothing. And so I don't encourage your patients necessarily to send them off, because oftentimes if it's not the typical ova and parasite testing, if it's not in stool and what they're normally testing for, they don't know. I don't think they know what they're faced with. But this gentleman had, I'm not kidding, 60 images at least of all the different parasites he pulled out. And he would feel them moving. When we were doing Firefly, he would actually feel them moving away. There was one time where he had intense pain, which was very unusual. And I actually called you about that. But that was this gentleman, very intense pain during Firefly. And I've never had that before. And I've never had that since, and doing this for several years. But he had such a terrible parasite burden. When you look at what he had gone through, it just makes sense. But he would do the full moon protocol, and I can take a look here at about how many he did over the course of how many months. But that was definitely a big part for him. And I think it started to get to him a little bit mentally to have all those parasites. It was scary to him, and he had lived all over the world. So like here in August, he had 2 in that week. Here he had the week before, he had 1. He had 1 in July, and he had 2 that week in July. So he did basically about 2 with the Firefly full moon protocols. So that's I'm alluding to is using some kind of a product line at the same time. Firefly in and of itself is very, very effective. You don't have to use anything with it. And there's also products or supplements you can use too that are effective. When you use them together, you can really have a synergistic response and really enhance the effects and have much more noticeable results. But you don't need to do supplements. Some people can't take them. Some people can't tolerate supplements for whatever reason. Some people just are having terrible stooling habits, and they're constipated. You have to be careful if you're going to give them something orally that's going to kill off species if they're not passing it, because they're going to hang on to the die-off and then have a Jerisch-Herxheimer reaction and become miserable.
Wow, incredible. Doing good work back there in Gladstone, right? Kansas City area.
Mm-hmm. Yep.
Great. Well, thank you so much for coming on again. Very much appreciated.
Yes, thank you, Dr. Bales.